Welcome, everyone. You know, wanting to look your best and maybe even a little younger, it's not just a lady thing. Men are also wanting to get in on the benefits of the latest facial rejuvenation options. So who better to talk about this than Dr. Christopher Maloney Jr. Doctor, thank you so much for coming back in.
Thank you for having me.
When I say who better to talk to, there's so many reasons why we come to you for these kinds of questions, but one of it is your training, your background. Kind of give us a recap on that.
Well, I trained in Boston at Harvard Plastic Surgery and went to medical school at Columbia and have been in town since 2002. So training experience is something that, you know, we have and that is important to us.
Well, and you're talking about 2002, so you've seen kind of ebbs and flows of the trends of everything in your field. What kind of percentage are we looking about when we say men wanting to get in on this?
Men with plastic surgery from the surgical side of things has grown to probably about 10% of our practice now. And I remember when, you know, certainly when I trained in Boston, it was very close to zero.
Wow. So that's why we're having this conversation, because we're seeing that kind of growing to a point where guys should know this is available.
Right.
Now, when we're talking about facial rejuvenation, surgical, non-surgical, what are some of the procedures that you're seeing they're asking for?
I think the most common things that we're seeing are skincare related, facelift and neck lift related, and then also eyelid surgery. So things oven related to the face are the things that we're really starting to see a lot of in our practice.
So, of course, and I know we're going to look at a lot of these before and afters that are going to hit on some of those things that you're talking about. What are some of the treatments specifically that kind of hit all of these things that we're talking about?
So from a surgical side of things, eyelid surgery, when you have extra upper eyelid surgery, sometimes it's even blocking your vision, easily corrected in the office. And a lot of people, it's facelift and neck lift. Patients have a lot of extra skin around their neck, and you know, they're very interested in doing something about it to improve how they look.
Now, do you think, I know you said from almost 0 to 10% today in your, you know, professional opinion, do you think that number is going to continue to grow?
Yeah, I can remember back in the past where plastic surgeons' offices used to have private separate entrances where people could sneak in and out of your office to keep it confidential. But because of television shows, media, and everything else, it's really become more forward. And, you know, women talk about it all the time, and now men are starting to really take better care of their skin and be more concerned about how they look.
And can I tell you that even on the women side of it, I do think that the stigma or the whatever to a lot of this, all the ladies are talking about it amongst ourselves. You know, what did you have? Where can I get it done? You know, give me the name of your doctor. This is kind of like normal, regular conversations. Guys, you're just getting in on this wonderful benefits of this. So I have to ask, if that's okay, doctor, have you used any of these things that we've been talking about?
Yeah, I've used Botox before, and I've had some of the light-based laser treatments to lift pigment from my face, and obviously the skincare products. Everything in our office, whether it's a procedure or a product, either I myself or someone on our staff has consumed or has used, and therefore if we're recommending something to a patient, you know, we're not going to recommend something that doesn't work or something that we haven't, you know, actually used ourselves.
Which I think that's great, because we were kind of chatting about that right before we started this interview. Being able to come from a first-person perspective when somebody comes in, that also makes them feel a lot better. Like, you know what it feels like, what I'll be going through, the wonderful results that I'll be getting. And of course, you look very handsome, so we know it does what it says it's going to do. So if a gentleman comes in, you know, we're kind of throwing a lot of things out there right now. Do they just come in and say, you know what, I'm kind of wanting this or that, and you kind of personalize the care from there?
Yeah, it's really an educational thing. People come in, think that they need or want something when they actually might need something completely different. So we actually can use 3D imaging to give simulations on some things. We can show before and after pictures of other people as well. So it's really kind of an educational thing, trying to figure out what best is going to serve their needs.
And we've actually talked about that 3D imaging another time that you've been on and seen some of those. And that really is, like you said, a good way to kind of give them an idea of what they'll be getting in the end result. And I bet that gives them a lot of peace of mind.
Yeah, it can be helpful.
And your office does a wonderful job. And I know I've said this several times. Your staff, doctor, is wonderful. Everyone that's ever come on the show, or we've been out places and I've done that, that also probably makes them feel a lot better coming into such a friendly office.
Yeah, they're very experienced and very warm, friendly people, and, you know, make people feel very comfortable. So getting in for that first consultation and getting to hear, you know, somebody firsthand that's used the products or services, can show them before and after pictures and really help them understand, what it's going to entail, that's very valuable.
Well, just the before and afters that we've been running this whole time, they're like mind-blowing. They look so amazing. Something that someone, maybe we always talk about also, you're gaining some confidence back in your life, and that's really what you're looking for. I'm going to tell them, doctor, how to get a hold of you guys, start that consultation, come in to see what's best for them. But thank you so much for sitting down with me to talk about this.
Thank you.
I know the gentlemen here in the room are already like, give me the phone number, Tina. Book your appointment today with Maloney Plastic Surgery. They are located at 3170 North Swan Road. And for more information, log on to maloneyplasticsurgery.com or just give them a call. They're at 520-298-2330.